pharmaceutical treatments to receive that sales tax exemption that's been granted to that industry.
Chip Paula, Clemens for Health. To my knowledge, no state has been challenged on that. None of the other 29 states that have a medical program. So,
okay.
Yep.
Anybody else? Okay. Then to kind of go back on the safety side, as far as for the consumer, what testing requirements do you think need to be in place to make sure that the chemicals and pesticides are held to the lowest levels possible?
So
Ron Durbin, Green the Vote. Not the ones that were proposed by the Department of Health originally. Let's be clear on that. They tried to adopt California standards. California standards, as they do with any industry, over-regulates for the sake of over-regulating, over-test for the sake of over-testing. There needs to be reasonable testing in place to test the products for things that will be harmful to the public. They need to be reasonable and they need to be cost-effective. The problem that any testing program can create is that the test can essentially take the product to such an extreme level of cost to get it tested that it makes the product inaccessible to the patients. And so that needs to be in place. But I would hold it to some similar standards as you would test any other product that's going to be introduced into the stream of commerce for consumption by people. You don't need to go beyond that for the sake of going beyond that. But there does need to be reasonable testing in place to ensure a safe product because confidence in the market and confidence in the medication is paramount. So we certainly would advocate for testing standards to be brought forth. And what I encouraged at the last meeting was additional committees or even studies done by a regulatory agency to try to come up with the least restrictive, most effective testing schedule that there can be.
Chip Paula, Clemens for Health. In our meeting with the Oklahoma State Department of Health, again, we strongly suggested that they remove the California testing standards, as Mr. Durbin, suggested. If you want to pick the worst in the industry, literally, California's testing standards are the worst. I think we all agree we need testing standards, and I think that is something that we left out of the law. And I think that you will see, as the industry turns up, everyone, we have to kind of for labeling requirements anyway, but everyone test. Now, I'll tell you this, what we suggested that we use to the Department of Health was the Illinois standards or the Nevada standards, both of which are very well thought of, both by industry and by regulators to be proper standards. But I'll tell you this just from, and I have an herbal products company. I mean, that's what I do in my daily life. We build and provide natural products. We're under FDA auspices. We have to do certain things to basically maintain a quality program and ensure safety. The standards that we suggest for marijuana are far, far over and above what we have to do in the natural products herbal supplement world. And again, we're agreeing to this and we want this because we want to protect consumer safety. The other thing that we want to begin to do is really set this industry up for FDA guidance because, like it or not, might be next year, it might be 5 years from now, but this industry will be under FDA guidance eventually in some form or another. So we might as well kind of set things up, and testing goes to that, and kind of regulations, in process and labs obviously go to that.
And Representative, we've had extensive language on this in our proposal. It's largely derived from Colorado, and then have had subsequent amendments to this from suggestions from folks within specifically the laboratory and testing portion of this industry. One area where I'll differ here is that we're ultimately talking about a medicine, and I think a lot of the approach for folks here in Oklahoma, especially in the medical community, is to have similar standards put in place for this as far as quality control goes, research and development opportunities. So we would like to see this treated like any other form of medicine beyond a supplement.
Okay, I've got about 30 seconds probably. I'll just one more question. So the providers that are going to be writing these prescriptions, are they going to be using the PMP to monitor prescriptions for medical marijuana like current medications?
Ron Durbin, Green the Vote. Under the current regulatory scheme proposed yesterday by the Department of Health. They're going to have a system for validation and verification of a patient's license that's available. My understanding is it's going to be voluntary. So I would advocate that there does need to be some way to screen this for, and I think what you do it at is you do it at, not at the doctor level. I think you do it at the dispensary level. That's the easiest place to do it. They can track, and a database could track what prescriptions have been doled out. They're going to have to check it anyway. Don't put that burden on a doctor. Keep it with the dispensary for checking in a statewide database of what has been dispensed under that patient account in a given period. That's the way to implement that and keep the burden off of the doctors. So.
And Representative Scott, New Solutions, Oklahoma, to respond to your question, there's multiple platforms like this in place and that actually manage how submissions and registrations actually integrate into these management systems. So we've proposed language for one that's basically what we see in most communities that have accessibility from both physicians, from the dispensaries, and from the regulatory agency.
Okay, thanks, gentlemen.
Thank you, Representative. Members, with that, we are going to take a 10-minute break, and that is a real 10-minute, not 10 minutes worth of questions. And we will be coming back at 11, let's go 11:50, so it's not 47. So you get 13 minutes. 10:50, we are coming back. You can have 13 minutes.